Hi, my name is Ben Meijer, and this video is about what is therapy? What is therapy? Therapy is about changing your life so that you can feel that you live a valuable life. You need to get into the driver's seat and change some things in your life. Maybe you need to change your relationship, be split up. Maybe you need to improve it. Maybe you need to change the relationship with your parents or your children, improve it, or maybe take more distance. Maybe you need to move. Maybe you need to get another job, but you need to change your life. If you're lucky, all you need to do is reprocess your past and get a different perspective. If you want to go to therapy and just use that to change the way you feel about a life which is going to stay the same, which may actually be pretty shitty, then you're going to shortchange yourself. The goal of therapy is to make sure that you are living a valuable life. The rest of therapy, right? We've got to start and finish with critical questions. There's a whole bunch of questions you can ask, but we should look at the questions first and keep thinking about questions and what are the best questions to ask. All right. Some of these questions could involve, what is effective therapy? What works? How do you know it works? What, of course, doesn't work? Also equally important. And you can ask the question, what role should medication have? Or is this useful for me? There's a whole bunch of questions. Like I said, we're going to come back to the questions in the end. As far as I'm concerned, any effective therapy needs to have a number of principles that the therapist is very conscious of and is always using in the back of his mind to guide him through therapy. These principles are formulated in the ACT therapy form very nicely, and some of them are in ACT 2 talking about 6 major principles, and some of them are values. Is this therapy dealing with what are your values? What do you think is important in life? And of course, that which you value now at 23, for instance, is not necessarily what you will be valuing at 27 or 32, or, what do you value in life? And then, if you know what you value, the question is, are you taking steps towards achieving that which you value? And steps towards need to be done by committed actions. Not thinking about, not just talking about, committed actions. You don't just arrive at a goal. You don't hope and pray. You make a plan. You break it down into steps, and then you take these steps towards achieving the goal. And of course, you're very critical, and you look at how far do I reach this goal. Right. Another ACT principle is the principle of fusion and diffusion. Fusion means that you're stuck in certain beliefs and feelings, and these feelings are actually hindering you achieving these goals, the goals that we're talking about, which are based, of course, on values. A goal is a short-term thing. A value is a long-term thing. All right. In another video, I talk more about fusion and diffusion and dealing with that. And that is an incredibly important part of clearing the garbage, clearing the baggage. All right. Another issue in therapy is therapy about talking, or is it about other things, right? As far as I'm concerned, you can't get around talking completely, but talking is not the goal of therapy. So it's a pitfall to spend a lot of time talking in therapy. As far as I'm concerned, therapy should be about intervention techniques and applying them. And of course, taking steps towards achieving those values, getting closer to the values. Now, intervention techniques can be applied, like for instance EMDR, can be applied in a therapeutic setting. And of course, there are a lot of intervention techniques that are not necessarily only limited to being done with a therapist. Now, I prefer to use a lot of self-help techniques and to guide my clients using these self-help techniques. One of the ones I always end up starting with is EFT, Emotional Freedom Techniques. Emotional Freedom Technique is a self-help technique, and it can certainly be a part of your total therapy package and used very nicely with the fusion diffusion part of ACT. And understanding it is very important. EFT can seem limited, but it's not. It's actually quite versatile and can be used in a great number of situations for a great number of issues. Like I said, I'm all for self-help because self-help tends to lead to self-reliance and being independent, not dependent. Now, I don't want people to be dependent on any therapist, including me. So I'm all for self-help and tools that actually promote empowerment, promote self-reliance, self-dependent independence. Now, I don't have the illusion that people can be independent of each other because we as human beings are social animals. It's normal to be part of the group and to enjoy that. We all enjoy sharing our story, both our negative stories like our problems and our successes with other human beings. And in sharing, we are human. It's part of what makes us human. The next important part of therapy is a part that I think has not been talked about enough, and that is the value of a therapist. Now, even though I try to make sure that you get as many self-help techniques and that I only coach you in becoming self-reliant and independent of me, the therapist is a crucial ingredient in the process. Why crucial? Because a good therapist will do a lot of the mirror you the problem. And a good therapist is a therapist who's done all these things on himself, who's basically swallowed his own medicine, if you like, who's applied all the therapy techniques on himself and gone through a lot of self-help and done a lot of critical thinking, probably a lot of meditation as well. I strongly value meditation as a part of the becoming more conscious part of development. And to be honest, as far as I'm concerned, there's a lot of therapists who apply techniques really well, but don't have the personal growth, the emotional development necessary to actually be able to help more complex clients and clients who are really deeply into their own emotional problems. And then the last important thing is the critical questions. Can you be critical of the therapy you're following with your present therapist? Can you be critical of the next therapist? Assumptions make an ass of you and me, and it's important to be critical. Critical is also the thing that the therapist needs to be. The therapist needs to measure the improvement that you're getting after applying techniques and taking steps in therapy. You need to measure, how does somebody feel? Are you getting closer to your values? Is your life actually changing? And are you living a more valuable life? Now, if you apply some of the principles correctly, you'll actually start to feel better, but feeling better is a pitfall because it's not only about feeling better. If it was only about feeling better, then a lot of religion and heroin would make you just feel better, but it doesn't make you feel that you're living a more valuable life. Okay, that, in short, was my notes about therapy and what therapy should be doing and should not be doing. So, short summary: always check if the ACT principles, the 6 ACT principles, are being used in therapy. Always check if there's not too much talking, if we're using useful and powerful intervention techniques. Make sure that you're becoming self-reliant, empowering yourself, independent. Make sure you've got a good therapist, a very intuitive therapist, a therapist who is not just in his head, but also is very aware of what you're feeling and what he's feeling, he or she is feeling, and that you can actually use your feelings and emotions to gauge where you are as a client. The therapist needs to be able to do that. And then the last is, of course, critical questions. Loads of critical questions. You need to have those critical questions, and your therapist needs to have critical questions. Thank you for listening. And of course, as always, please like, subscribe, leave questions in the comments below. And if you appreciate this and gives you value, please donate me a cup of coffee. Thank you.